Thousands of Americans are living with a hidden lung infection that mimics tuberculosis. It's known by the initials NTM. Amy Lietman is the president of the NTM Info and Research Organization, and she joins us now to help raise our awareness about this mysterious illness. Good morning, Amy.
Good morning.
What is the disease and what do we need to know about it?
Sure. So NTM stands for non-tuberculous mycobacteria. They're environmental bacteria. They're in soil and water. People with underlying lung damage, people with immune issues tend to be more susceptible to getting this. There are over 200,000 cases in the United States right now, and that number is growing 8% a year. So it's obviously a growing health concern in the country.
And I know this is a personal story for you. What is that connection?
My late stepmother had NTM, and when she was seeking treatment, she met other patients who, they couldn't find information just like her. So she and my father decided to start this organization to help other patients.
Very impressive. So, kind of help us understand what we're looking at and what potential patients might need to know.
Sure. So if you're getting more than 2 lower respiratory infections a year, you should talk to your doctor about getting a CT scan to see what's going on in your lungs. There should already be sort of a heightened suspicion that there's something going on. But the hallmark symptoms that patients talk about with NTM lung disease are fatigue, cough, and shortness of breath. And so sort of that combination. There's also some wheezing sometimes. Patients tend to lose weight sometimes. They can have night sweats with it. But those 3 hallmark symptoms, and when you're having respiratory symptoms and they're not going away on their own, or they keep coming back, you get a treatment, the treatment works for a little while and then it comes back, you should go see a specialist at that point. You should see a pulmonologist to have your lungs evaluated and see what's going on.
What can be done? What are the treatments and protocols?
Sure. So the antibiotic treatment is a multi-drug regimen of antibiotics for a length of time. It's usually 12 to 18 months. But in addition to that, there are a lot of other things you can do to help yourself and to help keep your lungs more healthy. Exercise is always a good idea to help keep your lungs healthy, but there's also airway clearance, which helps get mucus out and keeps your lungs clearer. There's nutrition, which is very important. I mentioned in these patients, some of them lose weight. That can make it harder for you to fight off infections. So you want to make sure your weight's at a stable level. Mental health support is critical. We have a really great network of support groups that we offer to patients. And there are a lot of other things that you can do to help yourself. And there's a lot of information actually available. If you go to worldntmday.org, you'll find out more about our World NTM Awareness Day, which is August 4th every year. And you can also find links to our website with a lot of information. You can find links to our support group network. And there's also information about webinars that we'll be hosting throughout the month of August. They're free and they're being held by experts in this disease state. And they're going to give people a lot more information about NTM.
Amy Lietman, thank you so much for this important and life-saving information.
Thank you.
More lifestyles for you right after this. Stay with us.